talks. Dr. Nirmal has, my OT talk is also there, but since he is the senior most, we thought we'll use his talk there. So let us see on the OT part, and then we quickly wrap up another few things and go into a discussion mode.
So planning and designing a safe and optimal OT. So this is the most important aspect in running a healthcare facility. So how to redesign or design my OT according to NABH guidelines? This is one of the frequently asked questions in many accreditation related meetings. And how do we ensure structure, process, and good outcomes in my OT? So are there any NABH guidelines? What are the standards and what are the references? So to answer this it will take a long time, but I'll just give you a brief note on what are the references. So very often people tend to ask about references. So the Indian standards, there is a part 1 to part 3, and various ISO standards give certain references. And IPHS norms for Indian healthcare facility was recently amended to include the infection control requirement also. And then the National Building Code or NBC norms for hospitals. So this is a 180-page document which focuses on fire zones, the type of construction, the general requirement, both for smaller hospital as well as high-rise building. An important aspect of NBC is the focus on heating, ventilation and air condition in the operation theatres and hospitals, and the guidance note issued by ASHRAE or the Indian counterpart ISHRAE, Indian Society for Heating, Refrigerating and Air Conditioning Engineers, who given their guidelines based on Environment Protection Act and National Ambient Air Quality Monitoring Series. The next important regulation or reference is the Clinical Establishment Act, which governs the licensing of healthcare facilities. So it has given norms for the space requirement for OT as well as minor OTs for minor procedures, and it also given various zoning requirement. For eye hospitals, only where procedures are done in local or regional anesthesia, minor OT criteria may be applicable. So what is the minimum requirement for a procedure room? Minimum requirement is 160 square feet. That includes the space requirement for anesthesia machine and a crash cart. NABH guidelines were formulated by quality experts, manufacturers, engineers and technical committee members, and these guidelines have been finalized to include two types of operation theatres. One is the super specialty OT, another one is the general OT. So ophthalmology theatres would come under the general OT. This includes the daycare centers where patients return on the same day. So for OT standard, the basic assumption have been kept in view that for each surgery patients, there will be 5 to 8 surgical team at any given point of time, and the equipment used to provide care would be around 5 to 7 kilowatts. And ambient temperature and humidity at each location to be considered while designing the system based on the space. The third regulatory requirement is the NABH standards. So there are two important chapters which focus on infection control and facility management and safety. Even though there are 8 other chapters, for OT designing, these 2 chapters are the major references. So the intent of NABH standards to provide a safe and secure environment for patients, their families and visitors, comply with the relevant rules and regulations and plan for emergencies. As you all know, infection control is an important parameter in hospital, particularly eye hospital. But infection control is a complex mixture of engineering, particle physics, microbiology, and medicine. So we understood this during the COVID time. So how the size, shape, density, and of course air movement plays a major role in control of infections. So basically, IoT is only the critical area in eye center. So you have to focus on structure, infrastructure, and superstructure, the process requirement, and the outcomes. So as a hospital leader, you have to think like a patient. If I am lying on this operating table, what do I want? So how safe the infrastructure should be there and equipment, or we focus on the lowest price or substandard structure above me. So this would be the defining question to focus on the short-term goals and long-term goals, the location and building design. Ideally, the operation theatre should be located outside the regular patient OPD areas, should also focus on the short-term and long-term goals and requirements. You have to focus on the equipment management and staff training, as well as patient safety and infection control. All these parameters have to be taken into in consideration before designing an operation theatre. So planning and designing a safe and optimal OT starts with a two-dimensional plan. The equipment required, the power outlet backup, the lighting required, the mental picture of surgery being carried out, and a three-dimensional view of the OT, review and revise the plan. So step one is write down the scope of services, the equipment needed, and the space requirement for your dream OT. The space requirements are given for the regular hospitals as well as day surgery units in the guidelines given by IPHSA. The engineering service requirements are also part of the ISHRE guidelines as well as the National Building Code. You have to focus on the air conditioning, ventilation, lighting, data and voice points, CCTV and MATV outlets, as well as the transportation requirements. So the layout generally should follow the unidirectional flow of men, material and access from one side. So there should not be mixing of sterile and unsterile product as well as areas. So ideally, an operation theatre complex should consist of 4 zones. The outer zone for receiving the patients, the restricted zone or clean zone for changing room, stores room and anesthetist room. The aseptic zone where the procedure is done, as well as area for instrument packing and sterilization. And then the disposal area where the used equipments are cleaned and biohazardous waste is disposed. So this is a 4 well-defined zones that makes our life easier while doing procedures. And you have to integrate the OP and OT for seamless patient flow. So along with the ward, as well as if you are running a daycare facility, how the patient will come from the OP or diagnostic areas to the operation unit. So basically you need to consider the design and structure as well as the equipment, and maintenance of OT should be taken into consideration while designing the operation theatre. So form follows function. And you also need to focus on the OT walls. It should be dust proof or moisture proof. The corner should be coated to prevent dust and facilitate cleaning. The door should be 2 deep with self-closing device. You should have facility for natural lighting and floor lighting for retina OT. The scrub up and sterilization areas have to be properly integrated into the design. You need to have a disinfection area where there is a hand wash facility as well as discharge table for soiled linen as well as instrument, and also need to have clean storage shelf to store the sterilized product. Ideally, there should be wall hung items to improve floor cleaning. The important aspect of infection control is the role of engineering controls. So the PPE is the least effective and most costly, whereas elimination and engineering control are most effective and least costly. So how do we incorporate engineering control and why should we incorporate? Basically, the air is used as a disinfection as well as dilution media by effective usage of ventilation. So you are diluting the infection control. You are improving the air quality by filtration. You are reducing the exposure time for infection by having a pressure differential or positive pressure. By using optimum temperature and humidity, you are also reducing the growth of microbial flora inside the operation theatre. So by adding ultraviolet treatment to the HVAC, you are reducing the viability of organism. Particularly this proved well during the COVID time where UV usage was rampant. And also airflow pattern. If you have a laminar airflow pattern, all the microbial agents are pushed out of the surface or the surgical areas. So this really helps in reducing the infection risk in the operation theatres. Ideally, operation theatre has to be a RCC control or construction or steel or modular build, and the AHU has to be dedicated one. It should not be linked to the air conditioning of other areas. And generally, window and split AC should not be used any type of OT because it is only a recirculation unit, and there can be convenient pockets for microbial growth which cannot be sealed. The ventilation requirement, there has to be continuous air purifying if you are having a AHU unit. The temperature, ideal temperature in operation theatre is 20 to 23. Relative humidity is 30 to 60 or 55 plus or minus 5. Air movements has to be from clean to less clean areas, and air changes has to happen minimum 15 total air changes per hour. So basically operation theatre design requirements are a legal requirement. Accreditation and empanelment standard require that theatre are properly built and designed. It helps in reducing the medical and surgical errors, and well-designed theatre is essential for better infection control. It offers a safe and comfortable area for all of us, patients, doctors and staff. Over the long period, the maintenance becomes easy and cheap if it's a well-designed theatre, and it also saves us from medical legal cases. So a well-designed planned OT is important to get good outcomes in our eye care facilities. Thank you so much for your kind attention.